Today we'll hear updates from our panelists, which include Director of Public Health, Catherine Wells, Local Health Authority, Dr. Ron Cook, Lubbock Economic Recovery Task Force co-chairs, Steve Massengale and Robert Taylor, and Lubbock Mayor Dan Pope. So let's start with Catherine Wells.
Good morning, and thank you for allowing me to provide an update once again on our ongoing COVID-19 situation here in Lubbock. Over the weekend, many of our local businesses reopened. This is good news for our economy, but all of us need to remember that reopening does not mean we can go back to how we interacted prior to this outbreak. Everyone needs to continue to limit gatherings, practice social distancing, stay at home if you are ill, and follow good hygiene practices. Don't let your guard down. We need everyone to follow these guidelines to keep our case counts down. Today, I'll update on your current numbers of COVID-19 cases in Lubbock County. The Health Department is reporting 553 cases as of yesterday evening, May 3rd. The department is pleased to see the number of cases drop for 3 weeks straight. The week ending April 19th, we had 123 cases. The following week, we had 68 cases. And this last week, we only reported 54 new cases in Lubbock County. This is a very different scenario than what's going on in other parts of the country and in Texas. And I'm glad that everybody is working to keep these numbers down. Unfortunately, we did report an additional COVID death this week, and the number of total COVID-related fatalities is 44. Recoveries also continue to be reported. Over the last week, 82 new recoveries were reported, and this exceeded our number of new cases reported here in Lubbock. The department is pleased with this data, and I hope we can continue to report these manageable numbers moving forward. This concludes my report for today, and I will now turn it over to Dr. Cook.
Thank you, Catherine. Let me just reiterate what Catherine said. This is good news for us. I think we got to remember, though, that the virus is still out there, and it was great to be outside in the sunshine. I love the sunshine. That's really why we live in West Texas, right? For the sunsets, the sunrises, and all the sun that we get out here. I saw lots of people out, which was good to see people out. I got to work in my yard, but when I got to see people out, I saw many keeping their social distance. I saw many wearing facial coverings. However, I did see some that were not keeping their social distancing and not wearing their facial coverings. And I know that the citizens of Lubbock care about the health of each other. And I'm going to pull on your heartstrings here for just a minute. I want the citizens of Lubbock to show us and to let your behavior show that you care about the health of others. And what I'd really mean is keep your social distancing, keep washing your hands, cover your cough, wear your facial coverings when you're out in public. So that's so important that we continue to slow this virus and spread it out. It's not going to go away, but hopefully we can put a wet blanket on it out here and it just continues to smolder and everybody's going to be okay. You know, I don't, and I know healthcare providers don't like wearing a face mask all the time. It's hot, it's stuffy, especially given the 100-degree heat that we had this weekend. But I wear one because I care about you and I don't want to give you the virus. And I wear one because I don't, just so I can keep my social distance. And so I want you to show us that you care about the health of other people, because you could be an asymptomatic carrier, meaning you don't know that you have the virus and that you give it to somebody else. And we have so many people in our community that can't afford to catch this virus. Many people have heart disease and diabetes and high blood pressure and obesity. And there are many that have transplants, liver transplants, heart transplants, lung transplants, and they're on drugs that shut down their immune system so that they don't reject those organs that they've been blessed with. Those people cannot afford, all those people that I just mentioned, can't afford to catch this virus because they won't do well with this virus. So in saying all that, show us that you care for the health of others by keeping your social distance and wear your facial covering. We're going to lick this virus this is good. You guys are doing a great job, but we got to continue to stay firm and keep our social distance and wear our facial coverings. That's all I have. Thanks. Lacey, back to you.
Thank you, Dr. Cook. And now for updates from the Lubbock Economic Recovery Task Force, or LERT, are the co-chairs Steve Massengale and Robert Taylor.
Thank you, Lacey. As you know, LERT has been working for over a week and several days, and we've divided into 4 specific committees. I'm going to give you a report this morning on the communications and our medical and science committee. We knew that as Lubbock reopened, the most important part of that strategy to open safely and responsibly would be communication. And we're so fortunate to have great media partners here in Lubbock, and I wanted to share those that have participated with us in Lubbock Safe. KCBD, KMAC, KOBK, Raymar Communications, Suddenlink Cable, Univision, Alpha Media Group, Raymar Communications on radio, Town Square Communications on radio, Walk by Faith Radio, Univision Radio, Wilkes Radio, Walker Communications Radio Group. Lamar Outdoor has supported us, as well as Choice Media Group, and print publications Latino Lubbock and the Lubbock Avalanche Journal have all given of their resources to allow us to run the message at no cost, which is very beneficial to our efforts. So through the weekend, we ran over 100 television PSAs, and we have done run over 400 radio PSAs. So very grateful to these media outlets that have supported us as we've communicated what it is to be Lubbock safe. Our medical and science committee really worked hard to strike a balance between lives and livelihoods to make sure we could open Lubbock safely. We continue to monitor 3 important pieces of data: our active cases, our new cases, and our hospital capacity. And we will continue to monitor those, and those numbers are what will tell us what's important as we move to phase 2. We have a meeting, our task force has a meeting today at 3 o'clock, and we will ask our medical and science committee to make comments on how Amarillo's cases and their surge might affect Lubbock. With that, I'll hand it over to Robert Taylor.
Okay, thank you, Steve. We did have our first education subcommittee, and that group chaired by Mark Griffin. Most of the meeting was centered around current school programs during the stay-at-home orders. We also talked about online summer school programs, both for public and higher education. Public school planning is going on right now to start back classes in the fall. Dr. Skubinek also, we heard from, and many of you heard from him, has outlined how tech will start back in the fall on campus with campus classes. LCU and Wayland are both putting together their plans for fall openings, and we'll learn a lot more about that at this Thursday's education meeting. Time was spent on a plan to hold a safe and possibly outdoor graduation for all high schools, for Lubbock, Cooper, and Friendship. Those plans are being put together as we speak. We feel strongly that the students need to be honored for the hard work they put in to graduate from school, and we need to do it before the summer. There'll be a lot of students moving around, taking jobs, starting careers, and this is a once-in-a-lifetime opportunity. So we're putting together a plan to make it where they can be honored and yet do it in extremely safe fashion. On the business side, Lubbock Safe program has really gotten off to a strong start. The program is one that's offered by the city and this task force to highlight businesses that are going above the required program for your health and safety. The governor has laid out a program for reopening businesses, but in Lubbock Safe, you can sign on to a program that your guests and your customers can walk in the door and feel like they've gone to an extra limit of safeties for your protection. We've had 1,355 starts on the website. 381 of those have been certified and completed, and 27 of those are outside the city of Lubbock and in the county. So that's over a 28% finish rate for that offering, and I feel sure we'll have more to come. The success of the program has been noticed state and area wide as we've had other cities contact us about the details of our program. I'd also like to take this opportunity to thank Lubbock citizens Carlin Rand and Mark McDougall for serving on the governor's strike force. It gives us a voice into the governors and to the governor's strike force on what's going on in our community and what we need and campaign for. Just briefly, from a business point of view, we care about our economy. We care about our 401ks. We care about jobs. We care about people going back to work. But we also care about the health and safety of our citizens. And I think these two go hand in hand. Without one, we're not going to get the other. So we need to work on both of these. And I really emphasize what Dr. Cook said, because it's in the best interest of everybody. This is not just that we open businesses doesn't mean that all of a sudden we've got lower risk. The risk remains the same, and it's up to Lubbock business people and our workforce to make sure that we do this in a safe manner so we can keep doing it. With that, I'll turn that over to our mayor, Dan Pope. Thank you.
Good morning. Thanks, Robert. Steve, thank you for your work. Dr. Cook and Ms. Wells, you guys continue to lead the way, and we're thankful for you. I want to make a few comments on the data, and then I want to talk about reopening weekend. So let's start with the data. As you know, we're tracking three key metrics. One is new cases. And so we've only had one day in the last 9 days where we've had, excuse me, back up. For the last 9 days, we've had no new case count over 20. And in fact, we'll start again because I've got my numbers wrong. I need to look at my notes instead of trying to do this from memory. For the last 19, tough start here. It's been 17 days since we had a situation where we had 20 new cases, okay? In the last 9 days, we've only had one of those where we had double-digit new cases. So the trend is very, very much to our liking. Second thing, active cases. Really a good trend on the active cases. In fact, we have 268 active cases today and 241 recovered cases. So we're seeing those numbers come very close together. Remember, you can follow this data on our city website, mylubbock.us. Click on the coronavirus link. It'll take you right to the health department website where this data is updated late every afternoon. The third thing we're following closely is hospital capacity. Yesterday, there were 27 inpatients in our two hospitals. And this is a little lower than where the trend has been in the low 30s. That the hospital capacity remains very strong. And we are committed to work with the hospitals to watch those numbers as they start to begin more normal kind of operations in their businesses. Now let's talk about testing. This is not one of those three key metrics, but it's one that we watch very closely. We've run 8,200 tests in Lubbock County since this all began. So we're still testing it right at 2 times the state average, although the overall state testing numbers are starting to climb, which is good news. We are testing at the Patterson Library in East Lubbock on Monday, Wednesday, and Friday afternoons. That started last Wednesday. If you want to get tested there, you need to call the health department, 775-2933 to schedule that. We're also thankful for testing at the Walmart at 114th and Quaker, at the Covenant drive-through testing location on at the Friendship ISD football stadium, high school football stadium, and the UMC drive-through testing, which has been there since the very beginning on their campus, sort of on southern part of their campus just north of the Marcia Sharp Freeway. Let's talk about reopening weekend for a minute. I think it was a very positive first weekend. A lot of people were out messaging. I got a lot of messages. There's so many people out, this and that. Well, that really is part of the idea. We reopened a lot of retail over the weekend, and we reopened restaurants. Many of them chose to open at 25% occupancy, and it was, I think, positive. Our fire marshal's office was out working with our businesses and really had very few problems. In fact, we probably had more challenges in our neighborhoods, where on Saturday night we had a lot of gatherings. We're all for people getting together. We'd like you to keep those to groups of less than 10, and we want to make sure you're social distancing. And I know with the weather we've had, it's been very difficult to do that, but let's try to do that. I also have heard from many of you who are not back to work yet. Men and women who are independent contractors, people who cut hair and do nails and work in our spas and work in our gyms. And we're working diligently and every day with the governor's office, with our strike force members here locally and statewide, the leadership of the strike force, to get you guys back to work. We hear you. We think in Lubbock you can responsibly and safely go back to work, and we will continue to work toward those ends. I'm thankful for Lubbock Safe and the work that's gone into that and how people have really bought into it. That is the right way to reopen our economy. You may have seen this weekend, Warren Buffett did his annual address and at the Berkshire Hathaway annual meeting. Instead of 40,000 people descending upon Omaha, he did it virtually. And he said a lot of things. He's a bright man. But one thing that I pulled away from it was he was talking about, in a question he was asked about recovery, he said something along the lines of, don't bet against the American spirit. Don't bet against the United States of America. You know, I feel very much that way. In fact, I found myself in a discussion this weekend with a friend about our recovery locally. And I remain bullish upon our recovery because of our diversified economy, because of the small business portion of our economy and the fact that we rely heavily on agriculture and that we require heavily on healthcare and higher education. I think we will come back in those areas quicker than many parts of the state and the country. The other thing that I really take a lot of solace in is the fact that the West Texas spirit is so strong. You know, a week from today, we will observe the 50th anniversary of the Lubbock tornado. And I've had a chance to talk to several media outlets about that and reflect upon it. And I can't have those conversations without talking about the men and women who led that recovery. I don't think it's any different today. That's still who we are. We will come back from this. And I think it's because of love. And I'm not going to preach to you, but I do think that we love our families. We love our neighbors. We love this place. We love Lubbock. And I believe, I know that is what is going to lead us to a very bright future. We're going to get there slowly. We're going to get there safely. Please be safe and be kind and always be hopeful. Thank you very much.
Thank you, Mayor, and thank you to our panelists. Now we'll open it up for our media questions. Today's media order is Sarah Self-Walbrick, Texas Tech Public Media, Matt Stell with KMAC, Karen McKay with KCBD, Terry Furman with KOBK, Matt Dotre, Lubbock Avalanche Journal, Don Rubio, The Daily Toreador, Blair Sable, Fox 34, Olga Aguero with El Editor, and Christy Martinez Garcia with Latino Lubbock. So let's get started with Sarah Self-Walberg.
Good morning. Can you all hear me?
Yes, ma'am.
Wonderful. So as we've added these testing sites and as we kind of continue to go through this, where do we see these three key metrics kind of going from here?
Dr. Cook, you want to answer that one?
You can clarify me the question for me just a little bit.
Sure. So yeah, we've added, the testing site at the Patterson branch and the Walmart location. We are starting to see some more people out and about and things like that. So kind of looking ahead, do we foresee any chance of a surge, or do we continue to think that this is going to go down, or is it hard to say?
Well, obviously, the more people that we can get tested, we can stop the virus sooner. But, if you're completely asymptomatic and you get tested and you're positive, certainly I'm going to ask you to go into isolation for the next 10 to 14 days. So that means you wouldn't be giving it to anybody else, right? So that's the whole purpose. And then certainly if you have symptoms, we want you to be tested and to make sure that you're not spreading it to anybody else. So then we can keep an eye on you there. That's part of our contact tracing and monitoring. So we look at both ill individuals and now that our testing is ramped up, we can hopefully start looking at more individuals that may be asymptomatic. I don't think we're quite there yet. So the whole purpose is to find pockets of disease and stop that process, stop that spread, so it just stays in that person or that household, and that it doesn't go anyplace else. That's the whole purpose of testing.
Good deal. And then one other question. We saw a lot of photos this weekend on social media of some places that maybe weren't following the guidelines as closely as recommended. It sounds like the first weekend went well, but do we see any change in how this is being enforced as we go forward?
As I alluded to in my comments, we had very few problems within the city limits. Our fire marshals operations were out largely trying to help our businesses with Lubbock Safe on Friday and on Saturday morning. Saturday evening, we had a number of calls, as I mentioned, about more neighborhood kind of gatherings. Sunday was relatively quiet. We're very aware of the situation at Buffalo Springs Lake. We were in communication with the county judge on Saturday afternoon. He was in communication with the lake manager, and we're pleased that they took action yesterday to close their beach for the foreseeable future. I would remind people that if they want to reach out to us about a situation that they feel is out of whack, outside the guidelines, to call the non-emergency line at Lubbock PD. That number is 775-2865.
Next, we have Matt Stell with KMAC.
Thanks, Lacey. Good morning, everybody. My first question is for Catherine Wells. Catherine, last time we checked, we had community spread cases, and that number was at around 80, if I'm not mistaken. We know the last two places we were told were the Walgreens Pharmacy off of Indiana and the Family Dollar off of North University. Do we know through that investigation if the community spread was through folks who worked at those locations, or people that were shopping there? It was a shopper that may have went there. How did we kind of give us how did you determine that there was spread there? Was it a worker, a shopper? If you could just kind of go into that for a quick moment.
Yeah, when we announce a community spread, we're really looking at, was there a period of time that someone who was infectious, so able to spread the disease to others, was in that location? So most of these, it tends to be someone who's working there because it's a longer amount of time. You can kind of tell from the time, but we're really looking at areas where there's nowhere where there's possibility of spread, and we have no way of contacting everybody in that facility.
Gotcha. Okay, thanks so much. My second question is for Mayor Pope. Mayor Pope, I know you saw that you've been made a meme. I think you said you've arrived now over the weekend regarding Buffalo Springs Lake. I mean, kind of tell us. I know you spoke on Buffalo Springs and how you're working with them. But what do you think about folks who say, man, we've got a social distance. Mayor Pope is he's gonna throw a fit. That folks I really know that you care about our safety. What's your response to that?
Well, first of all, thanks for recognizing the meme, Matt. My wife says that they should see me yelling at the refs at a Tech basketball game and use that as the meme. But anyway, that's an aside. We've had to make a number of difficult decisions. We're asking our citizens to be safe, to use common sense, to work together to get through this. That's all we can do. And I believe that the vast majority of our citizens buy into that and say that's the right thing to do. And we see that. We see that. I really believe in the health of our community. We see that in our numbers. We have a good trend and we have strong hospitals, and that allows us to reopen our economy and to do it safely. And that's so that puts people back to work. And that's what this is about, Matt. And we're going to continue to try to do that, to reopen small businesses, to put people back to work, and to do it safely. We don't want to sacrifice, do things too soon and sacrifice safety. And I think we're on a nice course.
All right. Thank you.
Okay, next we have Karen McKay with KCBD.
Good morning. I want you to know I was at the post office this week. There was a very, very long line. I was the only one in line wearing a mask. And I heard a lady behind me say to her friend, you don't have to wear a mask because they don't really work. I read that on the internet. So my question is to you, Dr. Cook. What would you say specifically to that lady and to all the other people who've looked on the internet and see that masks don't work? What evidence is there? What do they do?
Thanks, Karen, for that. I don't use Dr. Google for most of my medical information. I use respected journals on internet searches that I have access to. So anybody can post anything they want to and call it credible on the internet. That's just the internet. There are reasons why when we do procedures in the office or in the operating suite that we wear masks. That history has gone back eons to show that if you wear a mask during procedure, I'm not going to infect my patient. We're asking the citizens of Lubbock to do the same thing. You could be completely asymptomatic, shedding this virus, and if you wear a mask, you're going to certainly decrease the ability to spread that virus to somebody else. That's the whole reason when I'm in the operating suite or I'm doing a procedure in the office that I wear a mask so I don't give you something that I have, okay? There are studies that show that on the other side, is it gonna protect me from getting a virus? Probably, but not to the extent of me giving you the virus. So that's what I'm asking people to do, is wear a mask for the health of others because I care about you. That's the whole purpose.
Thank you, Dr. Cook. Thank you. And I have a question for the mayor as well. We talked about a lot of violations or a lot of people who maybe were testing the waters this weekend. Can you give us an idea, though, of how many violations there were? Were there hundreds or maybe a dozen or so, or were people just given warnings initially?
Karen, I don't have the number on citations yet. If there were any, we'll get those this afternoon late, but I can tell you that we did 31 inspections on Friday. We did another 31 plus 2 fires on Saturday. Our fire marshals have to go to fires also. And then we did 40 more yesterday. So about 100 over the weekend. And we'll have by the time we talk to you on Thursday, we'll have any information regarding citations.
Okay, our next question comes from Terry Furman, KOBK.
Good morning, everyone. My question is this. There's a local gym that says they are opening up this week despite the order to remain closed. They say that, quote, they support leaders, but when it comes to infringing on our civil liberties and constitutional rights and losing their business, that's something that they simply cannot allow to continue. Physical health is something we can work on every day to protect us from this virus. Quote, will they be cited if they decide to open?
So Terry, is that are you talking about Zach's Club West? Is that correct?
Yes, sir, that's correct.
Yeah, I think they've updated their position on Facebook. We had a chance to work with them this weekend.
Okay.
I'm thankful for Jared Atkinson, our city manager, and our city attorney's office, and we tried to first and foremost clarify what the governor's action said. And then the opinion that the Attorney General put out late in the week on that very same topic, specifically to gyms. This morning, I had a chance to talk to one of the owners and the manager of that facility. And, you know, I agree with their position. They're frustrated. They want to go back to work. They want people to be healthy. They want people to have a chance to work out. But we're not quite there yet. And we talked for about 30 minutes this morning. I've promised to share their thoughts with the strike force and with the governor's office. And we'd like to get them open, but I don't believe that they're going to open today. You can check with them on that to get an update from them.
Okay.
But what we had was some very good dialogue, and I think we both understand where we're coming from.
Okay, very good. My second question is this. We've been asked a lot about garage sales. Can people have garage sales or no?
I think the answer to that is yes. We'd like them to try to limit the number of people there to 10. We'd like to, or less than 10. And we like them to make sure they follow social distancing. I think if we follow common sense, we can get that one done.
Okay, very good. Thank y'all.
Thanks, Terry.
Okay, our next question is Matt Dotre with the Lubbock Avalanche Journal.
There we go. Hey, everyone. I have a question about Buffalo Springs Lake as well. Dr. Cook, I'm sure you've seen the pictures. Can you just talk about if someone had the virus or multiple people had the virus? Can you just talk about why that's so dangerous, a gathering to that magnitude, like how easily it could spread and what the impact of that could be?
Sure, happy to do so, Matt. You know, these are otherwise normally healthy individuals that have the physical capability to go out and be at a big group gathering like that. And so, you know, some of the pictures I saw, I didn't see anybody wearing a face mask or facial covering at the beach there. And so, you know, so these individuals, if somebody's sick or asymptomatic and are carrying the virus, and then, you know, so they're in a group of 10 or 15 people there, then they're going to hand this virus off to them. And then, so we'll see what happens in a week, 10 days, 14 days. Average incubation time is 7 to 10 days, maybe 14 days. So that's why it's so dangerous. And then these individuals then take it home to their households or their loved ones. And then now they're going to get their loved ones sick, and they don't mean to. Certainly nobody wants to purposefully give somebody an illness that could kill them. And obviously it can kill people. We know that at a much faster rate, higher rate than this is not just the flu. I've seen that. This is not just the flu. The ability to infect somebody, infect others in such a short period of time with such potential onslaught of disease process for those individuals, it can be devastating to certain individuals. And that's what we're trying to do. We're trying to slow it down, trying to stop it where that doesn't happen. That's a perfect place for that to occur.
Mm-hmm. Thank you. And can you talk a bit more about when we could start to see the effects of this opening weekend? I mean, will we not really understand it for 14 days now?
Anywhere from 7, 10, 14 days. The average onset is about 5 days before somebody starts getting symptomatic. If you're hospitalized, it's usually within 8 to 9 days. It's when your respiratory symptoms significantly worsen to the point that you have to go to the hospital.
Okay, next we have a Don Rubio with the Daily Toreador.
Hello, everyone. I guess my question is for someone on the Lubbock Economic Recovery Task Force. It was mentioned that you guys are just going to discuss plans regarding education. I was just wondering if there are any plans that you can tell us right now that, or items that you're going to be discussing regarding higher education and local universities and colleges.
You want to take that one, Robert?
Okay, sure. Yes, we Thursday is when we have our second meeting, and it's going to focus on higher education, as well as some public school, but mostly higher education. And the plans that are being worked on are being posted now. And I really think we'll get a better sense after Thursday's meeting of what campus life will look like. I think Dr. Stuvenek did a good job. If anybody saw him on CNN News during that interview, saying that campus life will not be the same as it was prior to COVID, but it will be different. But it will be face-to-face communication and teaching on the campuses. And LCU, Wayland, and all the higher educations that we're in touch with are following that same protocol.
I'll add to that. The work we do on the Lubbock Economic Recovery Task Force is all important, but in my opinion, the most important work we could do is as it applies to our campuses and our community. Nothing could have a bigger impact on the churn of our economy than students back in classes and faculties back in classrooms teaching, not to mention football come this fall. So our task force is poised to support our public school districts as well as our institutions of higher learning to make sure that we can do whatever it takes for them to open safely and responsibly.
All right. Well, I guess just as a follow-up question, I know even before this task force, there are plans in place for members of a campus community to learn more information and get in contact with someone in the campus administration. As of now, are there ways for someone like a student, faculty, staff member to get in contact with someone on the task force to learn more about what's going on?
Sure. One of the easiest ways to access the task force is at www.recoverlubbock.com, and there's a input form there that goes directly to us, and that's probably the quickest way to get to us. You're always welcome to call City Hall too. You can call my number at 775-2008.
Okay, now we have Blair Sable, Fox 34.
Hi all, good afternoon. My first question is for Dr. Cook. So we've been talking a lot about masks and facial coverings and how important they are. I know I've been wearing mine when I'm out in public, and maybe it's about a third of people wearing masks, that sort of thing, but I've also seen some issues with them. So what are some of the big mistakes that you see when people are wearing masks? Like, cross-contamination, maybe not wearing them properly.
Thank you. Appreciate that, Blair. Most of the problems I see with people wearing facial coverings is they wear them just below their nose. That doesn't do a lot of good because people are probably breathing in and out of their nose. I mean, it does kind of cover their mouth so if they cough or something like that, but you can exhale through your nose as well, and then that spreads the viruses. So if you're going to wear a facial covering, which I highly recommend, by the way, that it completely covered the nose and the face and the mouth. They are uncomfortable to wear, especially if you're outside in the heat. They're stuffy, that sort of thing. So that's the problem, I think. And then some people just don't like something on their face. And so, if you're working pretty hard trying to breathe through one, it becomes difficult. But remember, like I said, this is not just for me. It's so I can protect the person that's near me.
Thank you, Dr. Cook. And then my second question is for Mayor Pope. So I've heard you a few times mentioning this 10 people or less. And I'm just wondering, is there a particular recommendation that you're referencing with that? Is that from the CDC? Is that from the city? Is that just something that?
I'm sorry, Blair. Restate your question, Blair. I'm sorry. I couldn't hear what you said. You said you went out, you faded out there for a moment.
Oh, sorry about that. I was just wondering where this recommendation of 10 people or less is coming from.
Yeah, so the governor's order really didn't change when we reopened this weekend, and it still cites social gatherings. It cites CDC and White House guidelines. I think most recently it was the 30 days for reopening White House guidance. It may have cited that specifically. It's not in the order as such, but we feel like it's best practice. And it's something that we're going to continue to try to encourage is the 10 person max. We know that the governor has gotten feedback about maybe trying to be a bit more clear around that. We'll see if he does that this week, but that's the way we are interpreting it right now. And that's how we'll try to enforce it.
Okay, next we have Olga Guerrero with El Editor.
Hello, how are y'all doing?
Can y'all hear me?
Can you hear me? Can you hear me?
Yes.
Okay, I'm sorry, Lacey. I've got two questions, but just base a little bit on Buffalo. Apparently, it seems that they didn't have a plan in place, and maybe this will be different once they decide to open the beaches, okay? The first question will be for Catherine. How many people of the amount on the senior living are actually Hispanics? I mean, is there a number?
I don't have the data in front of me, but our dashboard updates by race and ethnicity.
Okay, I'll look that up.
Okay, it's on the city website.
Yes, ma'am. Thank you. The second question is there a policy or a plan in place for those that travel out of state and then come back to Lubbock? Do you still have to quarantine when you come back to Lubbock?
There's not thanks for your question, Ola. There's not a requirement to do that. I'll let Dr. Cook speak to this a little bit more. I think there's probably some public health and common sense kind of background that could be applied to this. Ron?
You know, Olga, recently there was a from CDC, there are certain cities that may have expired. I haven't checked on that this week, but there were certain cities that you needed to self-isolate from. You know, most recently was Louisiana. If you were coming from Louisiana, you had to self-isolate, but not anymore. So I think many of those have expired. I'd have to go to the CDC website to confirm that.
Okay, and our final media questioning is Christy Martinez Garcia from Latino Lubbock.
Good afternoon, everybody. Thank you for all your hard work. I do appreciate it. My first question is with Amarillo's number now surpassing ours over, I think it's 1,099. They have only 139 recovered and 12 deaths. What can we do to keep those cases from affecting Lubbock citizens? And I know that we've teamed up with cities around like Midland, Odessa, Abilene, and whatnot. What can we do to make sure that Lubbock citizens aren't affected by those communities?
Christy, it's a really good question, and thanks for bringing that up today. I think we would really encourage our citizens to not travel to Amarillo right now. That'd be first and foremost. That it's their situation, although centered around a couple of meat plants and a prison. There's a lot of community spread also, and so that would be first and foremost. The second is let's continue to do what we're doing locally. We're in constant communication with Amarillo. I talked to Mayor Nelson over the weekend several times. She's very thankful for the Fed's help in trying to isolate and do the contact tracing and actually do a bunch of testing and then contact tracing to try to, do the things we've done here locally, particularly with our nursing homes. And once you identify the problems, let's build a fence around it. Let's get those people well. When they're well, the community can start to get well. And so that would be what we're doing here. We've offered to help them any way we can. Their hospitals remain with ample capacity. That's one of the first questions you ask around that. But those numbers are going to spike some more there. They're getting, if you happen to notice, the pending test number that they had is very high. The CDC got there yesterday and they did a bunch of tests, and they'll continue to do that for this week, is my understanding.
Awesome. And before I ask my next question, I did message to see if any of you spoke Spanish, so that maybe you would want to extend a message in Spanish. If not, let me go to my next question. Does anybody speak Spanish though? No, that's okay.
Not well enough to answer your question.
Well, so my next question is more for Catherine. And I know we started doing testing in East Lubbock. Of the tests that you have done there, have you had any actual cases, or is it too soon to call?
No, we've actually tested 32 individuals, and 2 positives came out of that group. So we're glad to open that extra access point. And for anybody, there is city bus service to that facility, to that testing site. So we encourage anybody, no matter where you live in town, to access that site.
Okay, that concludes our media questions and our news conference. Thank you to our panelists and to our interpreters today for joining us. And our next news conference will be Thursday morning at 11:30. So we'll see.
Lacey, let me just add before we leave real quick. Christy, to your point about communicating in Spanish, that is important. And we have PSAs in Spanish, and you can view those soon will be able to view those at recoverlubbock.com. Sorry.
Okay, that's all right. Okay, so we'll see y'all here Thursday morning at 11:30.